Hi, my name's Dr. Camilla Cameron. I'm a doctor of traditional Chinese medicine for the last 23 years and a vagus nerve stimulation expert. Welcome to my video explaining exactly what electrical vagus nerve stimulation is. When we talk about stimulating the vagus nerve, a lot of people think of the manual versions of stimulating the vagus nerve. And there's numerous ways to stimulate the vagus nerve manually. Just to give you an example of the few things that people tend to think of, we're talking about things like dipping our head in freezing cold water, humming, singing, yoga, in particular, stretches like upward dog, which stretch the neck itself, which also stretches the nerve. Then we have things like grounding. We also have things like hugging and social interaction and laughing. And all of these things stimulate the vagus nerve manually via things like vibration or making the nerve very cold and constricting the area, which also stimulates the vagus nerve. And then we have things like hugging, for example, stimulates our parasympathetic response, which in turn tones our vagus nerve. But what I'd like to talk to you today is actually about the electrical stimulation of the vagus nerve. This is really very different to the manual version of stimulating the nerve in that it is much, much stronger and much more targeted. There are two main forms of electrical vagus nerve stimulation. The first form, which was developed in the 1980s, and it involves an insertion of a device in the chest cavity. So it's an implant of something like a TENS machine, very similar. And then it has a cord which goes from the very small TENS machine to around about the thyroid area of the vagus nerve and clamps onto one side there. Then it provides electrical stimulation to that nerve directly. So it's direct vagus nerve stimulation of an implanted device. The invasive version of vagus nerve stimulation is extremely effective and useful in situations where people require ongoing vagus nerve stimulation and also vagus nerve stimulation that is done repeatedly throughout the day. So I'm talking about perhaps 30 seconds every 6 minutes. This is much more practical than trying to use a non-inserted device. And generally, this is used for conditions such as epilepsy and also drug resistant depression. In around the year 2000, a non invasive version of vagus nerve stimulation was developed. And this is more appropriate for people who do not require such consistent, regular stimulation of the nerve. And it was an excellent development because while invasive vagus nerve stimulation is so appropriate for some people, it's also an invasive device, obviously, hence the name, and it's also quite difficult to remove if it doesn't work for you. So this new form that was developed in the year 2000-ish is a really great form for the majority of people requiring vagus nerve stimulation. Within my clinic, I utilise the non-invasive form of vagus nerve stimulation. This is also referred to as transcutaneous auricular vagus nerve stimulation. Yes, a mouthful, so you can probably see why I use the non-invasive version. Now, transcutaneous means piercing of the skin. We're not really piercing the skin, it's actually an electrical current penetrating the skin. And then auricular, it means ear. So essentially, what this means is we are applying an electrical current to the ear and then we're using that to stimulate the vagus nerve. So, this non invasive form is most useful for conditions that don't require that really regular stimulation. So, generally speaking, I think most people require a maximum of 20 to 30-minute sessions a day of vagus nerve stimulation. I generally wouldn't recommend more than that. And that's actually quite a lot. Most of the time, I'm recommending between 20 and 30 minutes once a day to start with. Then, as we see a resolution of symptoms and we're getting to maintenance doses, we're looking at 2 to 3 times a week at potentially 20 to 30 minutes a day. So, depending on the severity of the symptoms, the length, the duration that these symptoms have been occurring for, really depends on how long you'll need to do daily stimulation for. But it can be up to 6 months. It's not a quick fix, particularly for really chronic conditions. But you do tend to find symptoms reducing quite quickly and life changing kind of things occurring very quickly. But we want that resolution or at least that real reduction in symptoms where your life is completely different. And to get to that point requires quite a lot of stimulation, probably a bit of patience. But once you get there, then you just sit on a maintenance dose to keep tonifying the nerve. It's like saying if you go to the gym and you get buff, then you just stop. Well, you're not going to stay buff, are you? And that's pretty much like the nerve. We are literally exercising the nerve and tonifying the nerve. And that's something you do for life. You do it 2 or 3 times a week to allow it to continue to remain toned. The vagus nerve stimulation, which I conduct within my clinic and also that I sell online, involves the use of 4 clips. So we're using 2 clips within each ear. Now, the clips are surprisingly important in terms of the quality of these clips. There are lots of cheap clip options out there stating that they can work for vagus nerve stimulation. And in the very beginning, in 2018, when I started this, I naively thought, how much difference could the clips make? Let me tell you, a massive difference. So essentially, I find if the clips do not have good tension, in that they're not tight enough on the ear, they will not provide good conductivity. I also find there's a specific type out there at the moment that falls apart after you use it about 2 times, and people are using all sorts of things like elastic bands, etc. I also purchased these clips for my clinic and discovered within about 2 treatments that I could not use them. They look very similar to the ones I actually use, but they're very different in quality. So it's very important, 2 things, that it actually has good conductivity from the machine itself, but then also what is imperative is that it has very good conductivity at the ear. And it is required that it is quite tight on that ear to provide that. So I made it my mission to find the best clip I could find, and then I sought TGA approval on this. So as far as I know, I have the only good quality TGA approved clips in Australia for vagus nerve stimulation. Each ear will have 2 clips placed within the internal part of the external ear, the concha essentially. And this will provide several different sensations depending on which setting has been decided for you. So essentially, there are a few different sensations you may feel, and some of these are kind of a hard tapping, slightly intense feeling, but never sharp. There's other settings that are more kind of dispersed. There's still a tapping sensation, but not as intense. And then there are other settings that are actually more like a tingling sensation in the ear. The most important thing, or one of the most important things about vagus nerve stimulation, is it should never, ever be uncomfortable. So if it is painful and sharp, that's too strong for the nerve and is actually potentially providing damage to the nerve. So unlike a lot of people I see online, it is not meant to be uncomfortable. You are not meant to get it to a point where it's as high as you can take it. That's actually not how vagus nerve stimulation works. Vagus nerve stimulation very much works on a gentle, comfortable sensation. So, what can vagus nerve stimulation treat? And that's what I get asked all the time. There is another video which talks about the anatomy of the vagus nerve, where I actually go really in depth into what sort of symptom resolution we can expect through vagus nerve stimulation, how the vagus nerve affects really everything within our health. And that's probably a really good one to answer that question. But I will briefly surmise that essentially almost any health condition may benefit from using vagus nerve stimulation. Both the invasive and non-invasive versions of vagus nerve stimulation have been studied in depth. There are multiple studies on both of these and also on their potential side effects. So the auricular version of vagus nerve stimulation has shown up to have almost no side effects at all. The only side effect that is incredibly uncommon is that bradycardia may be experienced straight after vagus nerve stimulation. Bradycardia, the definition of this is a heart rate lower than 60 beats per minute. However, if you're really fit, this tends to be quite a normal heart rate for some people. So some people, 45 beats per minute would be more like bradycardia for them. And the only other thing they found as a potential side effect for transcutaneous auricular vagus nerve stimulation is that the clips can sometimes hurt the ear afterwards. I find this can be easily mitigated by using a great conductive gel. So I tend to use an ultrasound gel, for example, and I find this really does stop that problem where the ears may be a bit sore afterwards. Thank you so much for listening to my video about vagus nerve stimulation. I really truly believe that vagus nerve stimulation is just in its infancy, that we're just seeing the tip of that iceberg that will create great changes within our medical and health industry over the next few decades. So keep in touch, subscribe so you can learn more about vagus nerve stimulation.